Angiosarcoma, hemangiosarcoma, and malignant hemangioepithelioma are all terms describing the same disease, the malignant neoplasia arising from the endothelium. Since the endothelium belongs to vessels of any size and vessels are ubiquitous, such neoplasms may potentially spring up in any part of the body. However, in an overall rarity of occurrences, the skin, in particular the sunlight-exposed skin of the head and neck, breast, liver, and spleen, are involved at the utmost extent. Over the 37 years period from 1979 to 2016, in the Doubs department of Eastern France, the age-standardized incidence rate ranges from 0.1 to 0.2 per 100,000 persons per year. In the past, the workers of the industries polymerizing the vinyl chloride monomers, plastic materials, presented the most frequent occurrences. Nowadays, this type of processing is strictly carried out in sealed environment. In plastic material disposal or recycling, vinyl chloride monomers are not produced again. In that, the process includes shredding and incineration. In the more developed Western countries, the threshold value in workplaces is set at 1 part per million. Whenever angiosarcoma originates from the endothelium of the large vessels, such as the pulmonary artery, aorta, inferior cava vein, and heart, it is reported in the literature as intimal sarcoma. In this condition, early diagnosis is almost impossible. The intimal sarcoma is covered soon with thrombus, sometimes obstructing the lumen, and therefore it is equivalent to a pseudocoarctation. Metastatic thromboembolism is likely recurring, and therefore the prognosis is poor. Over 36 years, the Mayo Clinic reported only 13 cases of intimal sarcoma occurring in the pulmonary artery, aorta, and heart, with only 2 surviving beyond 5 years. Despite surgery and adjuvant therapy, the median survival was merely 8 months, although with a wide standard deviation. Out of an undifferentiated and solid growth pattern, Pagliarico and colleagues spotted cells with large nuclei and prominent nucleoli and some epithelial-like cells. Over 50% of the intimal sarcoma are CD31 and factor VIII positive. The distinctive marker of the large vessel intimal sarcoma is the amplification of the gene mouse double minute 2, MDM2, which may be expressed only in other kinds of malignant soft tissue sarcomas, such as dedifferentiated liposarcoma. The gene MDM2 encodes the namesake protein, which inhibits the tumor protein 53, TP53. Such protein has the function of slowing down nascent tumors. Another feature is that the intimal sarcoma may infiltrate the medium tunic of the large vessels, where spots of differentiation into osteosarcoma or leiomyosarcoma may be observed. A 51-year-old Italian woman who had been reporting abundant night sweating. Suddenly she perceived painful muscular cramps in her left calf and cold in her left foot. The symptoms vanished within a few hours at home. Some hours later, she underwent medical consultation, but only some mild swelling of the left ankle was evident. The general practitioner focused on venous pathology and investigated the saphenofemoral valve with an ultrasound scan. No regurgitation was detected. In addition, the patient's mother was affected by Raynaud's syndrome in her upper limbs, and therefore the smoothest explanation was that also the daughter might be affected, even if in her lower limbs. 2 months later, acute thromboembolic occlusion of both the tibial arteries of the left leg occurred. The emboli were spread from a thrombus in the descending thoracic aorta, which also showed nodular lumps in the medium tunic. As no risk factors for atherosclerosis were present, the first hypothesis was aortitis, but neither syphilis nor autoimmune diseases were assessed. The patient underwent surgery to replace the 10 cm long affected aorta. Intimal sarcoma was assessed at the histological examination. Unfortunately, the borders of the aorta were infiltrated, and therefore the surgery was not radical. Moreover, magnetic resonance imaging demonstrated multiple thromboembolic infarctions of the kidneys and the spleen, as was a lump in the left psoas muscle, supposed to be of metastatic origin. Chemotherapy was started. Unfortunately, most of the large vessel intimal sarcoma are painless, and the evidence of mild waves of thromboembolism fade away quickly. Thus, the diagnosis may be consistently built upon steady substructions of the vessel or large thromboembolism with persistent downstream ischemias. Although Raynaud's syndrome is very common in women and family-based, its onset nevertheless usually occurs particularly in teenagers or youngsters. The onset in adults and even in the lower limbs should be considered suspiciously and thus properly investigated through immunologic tests, cryoglobulins, rheumatoid factors, extractable nuclear antigens, etc., and other imaging tests